Hello. Let me take this opportunity to welcome you to this ministerial session. Would like to first welcome you to this session, which will introduce the resolutions and the summaries of the presentations that I've done this morning and yesterday, and also present the resolutions that were that the second E-Health and Telemedicine workshop and ministerial conference came up with, and the updated implementation of the resolution. And also this one will be followed by the ministerial dialogue with our honorable ministers from the partner states on the state of achievements in E-Health and Telemedicine. And we have also discussions with the honorable ministers from the partner states. The theme for this conference is embracing digital technologies to foster innovations in healthcare for well-being of East African. And the objective is to take advantage of these technology solutions to improve the healthcare delivery on behalf of the citizens of EAC, and also through establishment and implementation of effective national e-health strategies and programs, and also adopting the ICT and mobile technologies for health, as well as financial, sustainable financial business models for e-health and telemedicine. I welcome you to this session, and let me call the General Rapporteur to give us the highlights of the conference from day one to up to date, so that the honorable ministers can be updated on what has been deliberated on during the last 1.5 days. I thank you all. Dr. Gitao, please take us through the summaries of the deliberations that were done since yesterday. Thank you.
Thank you very much. Fortunate, the acting Executive Secretary for ESTECO, Honorable Secretary General for East African Community, all distinguished guests, and all protocol observed. I am George Gitao, the Rapporteur General for this conference, and also the Editor-in-Chief of the East African Journal of Science, Technology, and Innovation. I want to take this opportunity to briefly share a few slides on the summary of what this conference was targeting to achieve, and the various thematic areas that were shared. I hope you can see my screen here. I can see that. The theme of the conference for this third East African Regional E-Health and Telemedicine Workshop, Ministerial Conference, and big trade exhibition was already shared by Fortunate. The aim of this workshop was to enable East African partner states to take advantage of technology solutions to improve healthcare delivery for the benefit of all their citizens. And this was to be achieved, or will be achieved, through the establishment and implementation of efficient national health strategies and programs. And this will be followed by adoption of ICT and mobile technologies for health, which would then be supported by sustainable and financial and business model for e-health and telemedicine. The objective of the workshop and the ministerial conference was to provide a dialogue or a platform where the academia, the researchers, the technologies, the developers of technologies, and the government decision makers would meet to present and discuss existing and new digital technologies for enhancing healthcare within the East African region. The workshop theme was divided into 4 thematic areas, and out of these, there were 4 keynote speakers for each thematic area, and a total of 20 presenters participated, and the summary is going to be provided down in the next few slides. A total of 377 persons logged in and attended the workshop, and this was highly commendable. The first thematic area was embracing digital technologies to foster innovations in healthcare for the well-being of East Africans. There were 7 presentations, and these presentations were addressing the healthcare innovations that are creating enormous capacities to assess or access medical records, treat patients remotely with the limited qualified health personnel in the region. And that, of course, would allow even specialists who may not have a face-to-face encounter with patients to reach them through the technology. It will advance patient flow through digital engagement and ease of sharing information between different health departments. This, of course, has been enhanced and has been improved tremendously, as the presenters put it, after the COVID-19 outbreak. The other thematic area was the embracing digital technology to foster innovations in healthcare for the well-being of the East Africans. And this, this is a continuation of the first theme, and these ICT-enabled and mobile solutions applied in health services. And now with more citizens owning mobile phones, digital health is improving access through the medical health solutions and quality of health coverage, and capacity building, enhancing the quality of healthcare. The ICT opens up avenues of exploration and research, which allows experts to make healthcare more driven and effective than it has been. So those 6 presentations, or 7 presentations, which included the key thematic area, were trying to explore how health solutions coverage of patients could be enabled by the development and the capacities of embracing digital technology. The second thematic area, which was covered during the workshop, was on enhancing digital skills for healthcare personnel for improved service delivery. This is a build-up of the first theme, that when the technologies are made available, they start being applied more regularly, then you need to skill the personnel who are using them. There are 4 presentations, and these address the area of emerging digital tool developments, which include big data and development in artificial intelligence. There was a lot that was discussed about artificial intelligence to make the health workforce. So this is a human capacity building in the region as the frontline users of the technology, and need to equip them with new skills supported by policymakers who can understand and implement digital health strategies and infrastructure, put it to work effectively and safely. And then this session explored the role of governments and the private sector in providing capacity building to the health workers and improving e-literacy in healthcare. There was emphasis of partnership between the private sector and the government, because only through partnership would the capacity of the health workers and health service providers be enhanced tremendously. The third thematic area was on digital transformation to achieve universal health coverage in Africa. And the question was, how do we get it right? This was the longest session. There was one keynote address, and then there were 8 other presentations. And the session discussed developments in ICT-enabled devices and systems for health, bioinformatics, and management of information, with cross-border access to health services and e-health applications response, especially after the COVID-19 pandemic, among others. And I think all of us have learned what that entails, the sharing of information through the digital platform across the various regions, especially within the East African region. The next area within the thematic area number 3 was the motivation for long-term structural changes regarding delivery of healthcare has been boosted by the COVID-19 outbreak, making it more relevant by delivering healthcare remotely through telemedicine. And of course, the lessons that were being presented here, and that's why the question of the thematic area was, how do we get it right? After learning from the COVID-19 pandemic, how do we take it up to expand it to other disease situations? Now I hand over the meeting back to Mr. Fortuny. Thank you very much.
Thank you, Dr. Gitau. Let me take this opportunity to introduce Mr. Antoine Sebera, who is representing the Honorable Minister of ICT, Rwanda. Antoine, you are welcome. Also, Edith, who is representing the Ministry of Health, Republic of Rwanda. Edith, you are welcome. Honorable Chipanyura, you are welcome. Professor, he is representing Honorable Minister of Education, United Republic of Tanzania. Honorable Secretary General, let's go direct to the program. I would like to invite Secretary General East African Community, Honorable Dr. Peter Mathuki, to give us his remarks. Honorable SG, are you around? We can continue to the next speaker as we wait for EAC Secretary General, Professor Chipanyura, representing Honorable Minister of Education, United Republic of Tanzania. Kindly give us your opening remarks.
EAC Secretary, Honorable EAC Secretary, and all members who are here today. I have a great honor to join this important meeting that focuses on looking at the importance of digital technologies in the health sector. This is a very timely event, especially when all over the world we are talking of the 4th industrial revolution. I think it's important that as the East African bloc, we come together, discuss and strategize on how we can move forward in trying to embrace the digital technologies particularly in the health sector. On behalf of the Ministry of Education, Science and Technology, I would like to express her appreciation for the invitation to participate in this important forum. Unfortunately, she couldn't make it because of other obligations. But her humble request is that as the East African community, let us work together and see how best we can build capacity, internal capacity. Let us instill skills for our young people to make sure that they take full advantage of the fourth industrial revolution related technologies. Talking of the artificial intelligence, talking of robotics, the IoTs and all that. For the region to benefit, we really need to build the capacity. We need to have joint efforts to create a labor force that will at the end of the day benefit from the emerging technologies which are coming together with the 4IR. Having said that, let me wish you all the best, and once again, thank the Secretariat and the organizing committee for such a wonderful event. Thank you very much.
Thank you, Professor, for these words of building internal capacity of fourth industrial revolution and equipping EAC for the future challenges. I now welcome Edith Munyana, representing Honorable Minister of Health, Republic of Rwanda, to give us her opening remarks.
Thank you, Honorable Secretary General of East African Community. Thank you, Honorable SG representing the ESTECO, Honorable Ministers representing partner states. As a Minister of Health, Rwanda, we've been part of the East African Community from way back, and your contributions and partnerships are a big contributing factor to where we are today. We have seen that fostering digitization of the health sector can be a life-saving strategy if everyone embraces it and gives it their very best. As Rwanda being part of this integration, we've worked on several projects, and in those different projects include those that we integrate in between the partner states, like the one we're working on currently with the pharmaceutical registration information system, where we are able to track and license all the drugs within the country, even those those that help us to fight or cut down the pandemic. During this season, we've been working on revamping or reshaping our digital health, and we've come up with different policies where we put in place a digital health policy that was focusing on integration and harmonizing all digital health initiatives for public and private sector. We have been working on improving the ICT infrastructure across health facilities to ensure that our healthcare systems are interoperable. They are talking to each other. If when a patient moves from one hospital to the other, there is that seamless interoperability layer between systems. You're able to track one patient from one health facility to the other. And the other component we've been working on is the legal framework to ensure that we improve how data is managed. And by doing that, we've worked on the development of required capacity. And also we have developed what we call health data interoperability standards to ensure that the health data is governed in a proper manner. We have been able to ensure that if patient information is being exchanged across systems, how should it be handled? how should it be classified? Which one is personal identifiable information that should be handled with privacy, highest privacy, which is protected health information. All that information is classified in all those manners. We've also worked on digital research and innovation and continuing promoting healthcare delivery, where we worked on projects like how we put in place virtual hospitals, and were able to also start on projects like to facilitate precision medicine, where we started projects like E-Card to ensure that we start working on minimal invasive surgery. Also, another strategy that we developed during these years was around a digital health transformation strategy. And we were looking at things like changing the healthcare landscape, making sure that we are empowering the teams. We are putting in place skilled resources. And also the other part we looked at is ensuring that we engage our patients. Our patient engagement is key to improving the digital health. If a patient contributes to their patient file, the medical records are more interactive and meaningful, and foster the digitization of the healthcare. Also, we've been looking and focusing on clinical, optimizing clinical portals, or operationalizing these portals for clinicians to interact and be able to see that we are tracking where this doctor is working today or tomorrow or the other month, like the duty rosters and all that, to ensure that we are maximizing the output coming from these medical doctors. In transforming the care continuum, we focused also on population management, like client registries, ensuring that when a client or a patient moves from hospital A to hospital B, we are able to track this patient uniquely by implementing what we call a patient unique identifier. And in telemedicine, we've been working on telemedicine projects where teleconsultations take place within our HRH program to improve the skills of our medical doctors, where side by side we ship in specialists that train our local doctors, but this also happens via telemedicine platforms where those hospitals without the specialists can follow whatever is taking place and learn as they do the job. With also the few radiologists in country, we've managed to work on something we call PACS, Picture Archiving Solution System, where we are able to leverage from radiologists hospitals that have more radiologists to do virtual interpretation of lab or to do virtual interpretation of images, medical images, of course, and all that to ensure that we are fostering digitization for the health sector. We did a digital maturity assessment for the health sector to know where we stand, what should we improve, and what are the strategies that should be put in place to ensure that we reach that. And some of our success criteria, we realized that we would better focus on phased approaches versus coming down with digitization, being a big bang and saying we're going to do everything at once. We said, okay, these are the priorities. What should be done first? What should be done next to ensure that we improve the health, the quality of the healthcare for our citizens in the East African community. Of course, also we engaged partners, different partners, but focusing on our priorities to ensure that financially we can sustain ourselves. Also in selecting solutions, we were very keen looking at sustainable solutions. What can we choose? Why is it sustainable? Can we be able to handle this, excuse me, during and even after partners or anyone that could be supporting us is out of country or is no longer supporting us. So we also emphasize a lot on the sustainability plan for digital health. The other component we worked on very much was health information exchange. We realized that as a backbone for health sector digitization, as a key component to ensure that whatever is being done in the health sector, either the digital systems that are being used, if patients are able to exchange this information seamlessly, then it will be more meaningful. So we are building something we call a health information exchange with 6 registries, client registry, where I told you about where we have a registry of all the citizens with unique identifier or patient unique identifiers. Building a registry with all facility registries. We put in place a national product catalog with all coded medications, abiding with the international standards like the ATC and all that. Also worked on the terminology services, naming the same, giving codification for our disease, what we call disease codifications, like the ICD-11 for diseases, and also allowing for lab procedures and other standards that we put in place to ensure that digitization of digital health and telemedicine. Another thing that we focused on was the healthcare information security, where healthcare cybersecurity was focused on a lot, and we said, what should we put emphasis on? How should we manage accounts in information systems in the health sector? How should we authenticate? How should we authorize? How should we ensure single sign-ons and auditing logs, ensuring that patient information is not tampered with to gain more trust from our clients or our patients. With that, I don't know if I'll be having another session, so I'll move quickly so that by the time I'll not have another session, I'll have covered what I had today. One other thing that we focused on is ensuring that we have a unified citizen health record. One citizen, one health record, wherever they move to. If they move from hospital 1 to hospital B to C, we're at all the structures of the healthcare levels of Rwanda. So we put in place priorities, and those priorities, like I told you, range from, and we phase them, like I told you, we couldn't do a big bang. We phased them into phases, and in phase 1, we focused on priorities like the digital, the health data interoperability standards, where we developed standards guiding all players in the digital health space. If you're doing an electronic medical records and there's a disease codification, it must follow, let's say, ICD-11. It must follow, let's say, for lab, allowing OSNOMED CT or ATC for drugs. And we also, exchange is something we are continuing to build. I said it, I won't repeat. Enhancing electronic medical records is also something we are working on very hardly, ensuring that it automates the entire process of a hospital and integrating with the billing. What is this patient going to pay? If this patient is given medication, it should take away from the general store from our logistic management information system, so that by the time the dispensing is happening at health facilities, the general stock viewer is able to see that, let's say, paracetamols are reducing, and in terms of forecasting and planning, we need to plan and make sure that the country does not encounter stock out issues and all that by interlinking all the systems, that ensuring the systems are integrated and all that. The other thing that last priority that we are working on very hard is enhancing our community health workers. Rwanda has about 60,000 community health workers that deliver the primary health care mainly, and these healthcare workers are given a mobile-based application that report incidents, what we call red alerts, and they track our under 5 and pregnant women, and this has really helped us to curb down or to drop down the maternal mortality rate, and it has helped us to improve the health status of our under 5 that could die if there's no alerts that are sent to a nearby ambulance, a nearby health facility, and to the central level for us to follow up if this urgent case has been attended to. Lastly, we also focus a lot on the infrastructure for all these systems, for digital health to flourish, for it to really be attained, is ensuring that there's adequate infrastructure in terms of local area networks, in terms of internet, in terms of also equipment for all these digital systems to be implemented. We realize that a number of equipment has to be put in place: computers, tablets, smartphones, barcode readers and scanners and all that, to ensure that this is attained. And lastly, also the hosting, ensuring that there is no downtime if we're putting people online, if we're digitizing all the systems, if we are removing people from using paper-based papers at health facilities, we must ensure that there are no downtimes by ensuring that is implementing a cloud infrastructures, but also knowing that when the cloud is down, there's a disaster recovery site to ensure that patients or hospitals will continue working with or without internet at those health facilities. With that, I thank you for the opportunity to participate in this conference. And as Rwanda, we are happy to contribute and to learn from other countries in how we can improve digital health in the East African community. Thank you very much.
Thank you, Honorable Edith. It's quite work that has been done by the Republic of Rwanda of all creating an enabling environment on developing the digital health strategies and policies, and they would like you'd have another chance to share and discuss more information about your initiatives in Rwanda. Honorable Secretary General, are you around?
Yes, I am.
Oh, yeah, I welcome you, sir, to give your opening remarks. We apologize for the hiccup on the internet.
Okay. Thank you very much, Fortunate Muyambi, the Executive Secretary of the STICO, and all the delegates here present, the honorable ministers in this meeting. I want to thank you for creating time to join us, and appreciate that you give the community that kind of weight, which is demonstrated by your presence in our meetings. We are okay in Arusha, doing well. I'm currently hosting the ambassadors of the EAC in URT, so we are doing okay. But I want to thank you, Fortunate, and the team for putting together this conference, whose theme is embracing and digital technologies to foster innovations in healthcare for well-being of East Africans. And I agree it comes at the right time when the community and partner states of the EAC are facing such a big challenge, particularly because of COVID. So I want to really say that it is timely, but appreciate that the East African community, through the Vision 2050, and part of the 6th EAC development strategy, we of course put digitalization as a key strategy, and this is the way to go, because that is what the world is demanding. And we have now done a number of initiatives that, of course, promote digitalization. So as you are aware, the East African Science and Technology Commission, they signed a memorandum of understanding on behalf of the EAC Vital Wave, and to apply an enterprise architecture approach that enables and supports a comprehensive, regional digital agenda across a number of key sectors. And these initiatives will build on the progress made over the last several years in the health sector. And therefore, as the East African community, digital health is gaining momentum, and we feel it's the high time, and specifically now engaging with a number of initiatives which promote this. And we've been, from 2010, we've been undertaking these initiatives and supporting programs. Therefore, now for you, for the last 2 days, the conference that we've been having, and some of the issues that have been read out, you concurred with the STICO that, in collaboration with the Secretariat, that in fact, and it's of course the partner states and others, you've come out with a number of resolutions which we fully associate ourselves with. And therefore, thank you, and let us now stand together. And I want to agree with Edith Munyana that indeed this is the way to go, and we need to work together as a partner states of the EEC in the initiatives that are going to promote our solidarity and our unity, particularly to serve the people of East Africa. And we have seen during COVID, some of the partner states have even gone further to use technology in even reaching out to the population, ensuring that they get, medication, and they get, kits that are to responding to COVID. And that tells you the community is ready. The partner states of the EAC are ready for this. And therefore, I think it's important and the high time that all of us working together, we will take advantage of this, and we will be able to make our community, digital ready at all levels. Therefore, I want to inform you that EAC is now seeking to continue improving on the healthcare delivery. And this is, again, working closely with a number of development partners that support and whom we think alike. And so I want to thank you for the time. And therefore, I think this conference is going to inform a number of decision-making, particularly the ministerial, particularly at the main Council of Ministers. And therefore, some of these resolutions reached out during this will be critical, and I'm sure they will influence policy, and ultimately they will try to improve the lives of the people in East Africa. I want to thank all of you, and appreciate that you had a successful conference, and assure you that STICO will implement the ministerial resolutions which have been read out and that have come out of this conference. But most importantly, to see how some of these resolutions can be mainstreamed in the policy, making through the structures that are available through the Council of Ministers, and ultimately they become policy at the regional level. I want to thank you and wish you well, and once more congratulate you and thank all of you for the continuous support that you continue to accord the Secretariat, the EAC, as we are here to serve you and to work for the people of East Africa. Thank you very much, and have a lovely afternoon.
Thank you, Honorable SG. The next speaker is Antoine Sebera. Please give us your opening remarks. You are welcome, Antoine.
Thank you very much. I hope you can hear me well.
Yes.
So, honorable ministers, honorable Secretary General, distinguished ladies and gentlemen, it's a great pleasure to join today's dialogue on the strategies and policies regulation for e-health and telemedicine. I'd like to first take the opportunity to also congratulate the East African Science and Technology Commission for the successful organization of the third EAC Regional E-Health and Telemedicine Conference. This ongoing COVID-19 pandemic has emphasized more than ever the importance of having digital transformation at the center of our socio-economic development policies and strategies. For us to build thriving and resilient countries, we need really to embrace these kind of technologies and put them as part of our various agendas. It's also important to achieve the full potential of such technologies in key sectors, such as the healthcare sector, together with others. But more importantly, the health sector, as it's the one that's really at the core of providing the people who can work in different areas. As the EAC bloc, we believe we should thrive towards continuous innovation in the health sector, fully embracing digital technologies within the government, but also working closely with the private sector, the researchers, the startups, to create more value, to bring more ideas on the market in different aspects. One being universal access to healthcare, while at the same time we think about improving the patient information. How do we get completeness of information at any point of care? Such technologies give us also a very good opportunity to leverage data for evidence-based decision-making, promoting clinical research, and really having good insights that will help the entire sector think to the best. We also have opportunity at looking at how we can streamline and facilitate cross-border access to healthcare. When some services are not available in one country, you are free to go to the next country where you can get the best healthcare, in having access by doctors, by nurses to your health information. While we pursue this, we need to be very cautious about the protection of sensitive data from any unauthorized or harmful usage. This will be very critical for the success of such endeavor. Since 2019, in Rwanda, we have worked toward a comprehensive digital transformation roadmap for the health sector. And we identified key priorities that span over a period of 5 years. I believe my colleague already mentioned them, seeing the likes of upgrading the EMR, the health information exchange, data management, so on and so forth. So we believe having a clear roadmap not only put us on the right track to achieve the best we can in the sector, but also putting the effort into it, mobilizing the resources, mobilizing the population, various stakeholders, so that we all achieve. So we would like to commend and encourage the continuous collaboration, sharing of information and best practices among the member countries through platforms as this conference, and of course other conferences, so that we can together build effective and resilient healthcare sectors across the EAC and the continent at large. We believe this is very possible with the commitment of the leadership of our respective countries and the region. With that, I thank you so much for your kind understanding. Thank you very much.
Thank you, Honorable Antoine. With these initiatives that ICT Ministry is implementing in Rwanda, and they would like also to share such experience and lessons learned during our discussion in this ministerial session. I now call upon Honorable Dr. Faustin, Honorable Minister of ICT, Republic of Tanzania.
Thank you so much. Honorable Ministers, Honorable Secretary General, first of all, I would like to congratulate EAC for this wonderful workshop. In short, let me go for Tanzania initiatives, especially in this digital initiatives. It has been evident that digital technologies provides opportunities to accelerate national, regional, and global efforts in attaining health and well-being related to SDGs, especially goal number 3, which seek to ensure health and well-being for all at every stage of life. In order to attain this aspiration, there is a need for a flexible, dynamic, and supportive legal and regulatory framework. This includes frameworks to support ICT uptakes in various sectors, as well as health sector. In this regard, there are several initiatives at country level that include the development of National ICT Policy of 2016 and its implementation strategies, which started 2016 to 2021, 5 years, which provides a framework for development and growth of ICT industry to enable it to serve as a catalyst for socio-economic development in the country. In addition, it has set direction that have been instrumental for the country to attain aspirations stipulated in the National 5 Years Development Plan, National Vision 2025, and EAC Vision 2050. Furthermore, there are existing challenges or fears of patient safety, data security and protection, and privacy issues associated with the use of e-health tools continue to pose major risk to development of e-health, and therefore require deliberate policy and legal framework guidance. Also, effective regional policy and legal instrument from a cross-border exchange of data and information, including for rapid alert systems in case of outbreaks among partner states are lacking. In order to cater for the situation, the country have established several frameworks that includes the National Cybersecurity Act of 2015, a National Cybersecurity Strategy of 2018 to 2023, and the process are underway to establish a Personal Data Protection Act. We hope maybe by this year or early next year, the act will be in place. This act will address difficulties pertaining to data protection, data safeguard, and cross-border data sharing issues that existing in the current legislations, including but not limited to the HIV/AIDS Act of 2008, Public Health Act of 2009, and the Human DNA Regulation Act of 2009. Tanzania is also pertaining effective in other region integration effort, whereby in 2019, the country ratified EAC protocol on ICT networks. The aim of the protocol is to promote availability, affordability, and equality and the quality of ICT services within the community. So in terms of infrastructure, ICT infrastructure forms the foundations for electronic communication and information sharing across the geographical and health sector boundaries. This includes the network connectivity, ICT device, and the core services that underpin the national e-health environment. In this recognition, the government, through the Ministry of Communication and Information Technology, has deployed the national broadband backbone, which connects all regions in Tanzania and Zanzibar. as well as neighboring countries, all neighboring countries, Rwanda, Burundi, Kenya, Malawi, Uganda, Zambia, and also now we are in the final stages connecting connecting Mozambique. And also we have a plans from next financial year, which will start July this year, to extend the national backbone to the district level countrywide. As a member state of EAC, Tanzania is participating in the programs for infrastructure development in Africa, PIDA, where we have 2 projects of connecting Mozambique and connecting DRC. Furthermore, telecom infrastructure being deployed by telecom operators as through private financing and government subsidy that have resulted into the mobile network within the country reach 94% of population and 66% of geographical coverage. This is accelerated accessibility of mobile-based services in health sector, even in rural and underserved areas. Despite the mobile network coverage is dominated by 2G as opposed to 3G and 4G, making it difficult to most of the citizens to access digital services available. For the national broadband strategy of 2021 to 2026, we have a plan to extend the coverage, broadband coverage, to reach 80% countrywide by 2025. Other initiatives we have the government, we have constructed the internet data center, a national internet data center, which provide hosting environment from both public and private sector. And the specific for health, we have a initiative which we call Tanzania Community Digitalization. In this initiative, we are planning to connect schools and health facilities. To be specific, for health facilities, our plan is to connect more than 5,000 health facilities countrywide. So we hope if we manage to connect those health facilities within 10 years, it will accelerate the usage of digital technologies in health sector. And the other initiative is about the capacity building and the skills, and digital skills. In order to prosper with a 4th industrial revolution, the country needs to embark on initiatives that are necessary to build the capacity required in 4th industrial revolution era to support the digital economy. This includes building digital skills to lower levels, and thus revisiting our education system in paramount, as well as ensuring training provided to cope with the need of 4IR. This will require the engagement of both private and public sector. At the ministry, we have developed a digital skills gap necessary for the country to cope with the current development. Efforts are underway to ensure that the gap is addressed. To conclude, the ministry is ready to collaborate with all stakeholders within the region, including public sector, policy, and and the decision makers, including ministries responsible for health and ICT and education, medical professionals, pharmacy and the health insurance sector, private and the business sector, including digital health innovators, entrepreneurs, ICT industry, technology, and ICT solution vendors, academia, research, and the development institution, and also civil society, to realize the theme of the workshop and the ministerial dialogue geared at embracing digital technologies to foster innovation in healthcare for well-being of East Africa. Thank you so much.
Thank you, Peter, for elaborating the initiatives in the United Republic of Tanzania. I welcome
Honorable Samuel Mulindwa, the Permanent Secretary representing the Minister of Education, Republic of Rwanda. Samuel, you are welcome.
Good afternoon, distinguished ladies and gentlemen, honorable ministers, the Secretary General for the East African Community, distinguished participants. Good afternoon once again. And of course, would like to take this opportunity to thank the organizers of this conference, ISTECO, for an excellent meeting that has been organized. And in light of what has been done, I think the two speakers from the government of Rwanda, of course, have provided detailed, elaborate strategies, but from the Ministry of Education, I think our efforts have been put in building capacities in ICT and technology. For the Ministry of Education, this is a component that has been strongly been invested into, because we believe that skills development and human capital development is a key component in building other skills in other sectors within the economy. So the Ministry of Education has prioritized funding within the health sector, skills development within the health sector, and I think specific strategies have been established. There is a dedicated strategy for development of health sector professionals that was adopted in 2019, and I think which constitutes the backbone of all the capacities in different areas within the health sector that ought to be developed, right from, hello?
Yeah, we are hearing you. So we are hearing you, Samuel, please.
Right from the nurses to doctors and highly specialized skills. And on that note, a specialized secretariat was established for human capital development exclusively for the health sector. But in light of the subject matter at hand for the discussion, government has also invested enormously in infrastructure for ICT. I think Tony briefly mentioned about it. The government of Rwanda has put up a fiber optic almost in every other area of this country, Rwanda, which enables different health facilities, as mentioned by Edith, to access internet, which is a very critical component. But apart from that, from the side of the Ministry of Education, we empower every other graduate at every other level to be well conversant with the usage of ICT. I think this is a critical component that the government of Rwanda has done in strengthening the human capital for health. But not only that, we have positioned our people, especially those accessing higher education, to ensure that they are all ICT literate. And actually ICT is mandatory irrespective of any course, to ensure that all people are up to what is required within the 21st century skills. And of course, in light of that, as the East African community, I think the government of Rwanda is more than willing to share experiences and of course, technology transfer where possible in some of the gains of what has been done in terms of human capital development for health and even ICT. And I think we're more than willing to be sharing such experiences, because the details related to what has been happening in IT and health, my colleagues have mentioned. I don't want to repeat what they've said, but we are more than willing to be sharing any other experience of what is happening in human capital development within Rwanda to the region. Thank you very much, dear participants.
Thank you, Samuel, for those elaborate initiatives, in addition to those that were already elaborated by your colleagues, honorable ministers from Republic of Rwanda. I now take this opportunity to present to you the key action points of the E-Health and Telemedicine conference that will be adopted by this ministerial session. They are the resolutions that were deliberated on during this conference, and we shall have a discussion after. This presentation. The resolution are normally taken up by the EAC organs and institutions for implementation, but some of them are partner states are also driven. They drive the implementation of such resolutions. The first resolution for the third E-Health Regional E-Health and Telemedicine Ministerial Conference is to urge the partner states to implement e-health and readiness gaps identified as per the e-health assessment done, that include governing structures, health information standards, human resource capacities, enterprise architecture, legal and regulatory framework for data sharing and security. And it's good that the ministries in the EAC have already started the implementation of this, as elaborated on by the Republic of Rwanda on terms of data sharing and cyber security on information. The second resolution is a stake to promote incubation of local digital health solutions in collaboration with the EAC Secretariat and partner states, ministries and agencies responsible for ICT, science, technology, and innovation. And this incubation also, we have seen that some partner states have already started on that, and the STECO would be promoting such an incubation for the local digital health solutions in upcoming years. The third is the STECO in collaboration with the East African Health Research Commission to develop a EAC regional digital health agenda framework, and these frameworks have also been nationalized at the national level. And some of the countries have already developed the e-health frameworks, the health digital frameworks that are being implemented in the countries in terms of enabling environment for the implementation of e-health initiatives. The fourth is East African Community Science and Technology Commission, in collaboration with the East African Health Research Commission, develop and implement EAC Regional Digital Health Program that will embrace digital technologies to foster innovation in health care for the well-being of East Africans. Honorable members, honorable ministers, the fifth is the STECO take lead in the collaboration with the East African Health Research Commission and EAC Secretariat to develop an EAC Regional Health and Telemedicine 5-year strategic plan and the monitoring and evaluation framework 23-28 based on World Health Organization and ITU toolkit in collaboration with the partner states and development partners. Honorable ministers, the sixth resolution is a stake in collaboration with the East African Health Research Commission and the Secretariat and the partner states convene the fourth EAC region, E-Health Regional and Telemedicine conference and ministerial conference in Nairobi, Kenya from 24th to 26th October 2023. Honorable members, the seventh resolution is a STECO in collaboration with partner states, National Councils of Science and Technology, East African Health Research Commission, EAC Secretariat to develop an initiative e-health and telemedicine innovations to support emergency preparedness for the pandemics such as COVID-19 and others. Honorable Ministers, the 8th resolution is the partner states to allocate funding to ESTECO to complete an e-health readiness assessment in Burundi and South Sudan by incorporating aspects of the systems in collaboration with the EAC Secretariat and the East African Health Research Commission. Honorable members, the 9th resolution is EAC Regional Center of Excellence for Biomedical Engineering at the University of Rwanda to develop and implement a tripartite SEBE East African Science and Technology Commission and the University Council a memorandum of understanding to promote e-learning systems for training, e-health care and support from partner states and development partners. Honorable members, the last resolution, the 10th, is EAC Partner States that have not developed a national e-health strategy or policies to develop it in line with the World Health Organization and ITU National E-Health Strategy Toolkit by 2022. Honorable members, these are the resolutions, and we would like to immediately jump into these resolutions. We can discuss, and would like to get your opinion from these resolutions for the implementation. First of all, adoption and the consequent implementation in the EAC region. I would like to welcome honorable members to discuss these resolutions, and we'll start with any question or any elaboration on these. Just raise your hands, and I will be able to give you a chance to elaborate or discuss this resolution. I thank you all. Thank you.
Thank you, moderator. I would like to bring your attention to resolution number 9, where a tripartite arrangement for the MOU needs to be done with SEBE. Of course, you are specifically mentioning STECO and ICT, sorry. And I would like to get more clarification. Why only these 3? And of course, you know, why was the choice limited to this in light of this? Because I believe that this regional center of excellence for biomedical engineering at the University of Rwanda would definitely, you know, be not limited to, because there could be so many other institutions which are more than, you know, these 3 that have been limited, identified. So I'm wondering why these 3?
Thank you, Honorable Mrindwa. Originally, SEBE and the East African community have had a long-term relationship in terms of E-Health and Telemedicine initiatives. And again, SEBE was awarded the Center of Excellence by East African community. And also, Inter-University Council is also one of the institutions of the EAC on education and standards in the EAC. That's the background of the relationship with these 3 institutions. And the SEBE has also been involved in the first E-Health conference, the second, and now the third. And there was also in the grant which was given to SEBE through East African Development Bank in collaboration with the East African Secretariat to develop and implement e-health initiatives in Rwanda, and also carry out capacity building in e-health, equipping skills, and also building infrastructure for implementation of e-health. So that is the brief history of the 3 institutions. But if you would like to recommend another institution that we can have, we shall be grateful for your suggestion. I thank you. Honorable Chimpanyura, you have your hand raised.
Thank you, Executive Secretary. I would like to bring attention of members to resolution number 2, and that is about incubation of local digital technologies. This is to me, this is a very important resolution, and I think we could strengthen it further by adding another component of kind of mapping out the digital technologies within the East African region. And why I'm saying so, because in the era of COVID-19, we have seen a number of technologies, a number of digital solutions to the health sector, but then we don't know who is doing what. In a way, there has to be coordination so that if we decide to incubate some, let's say in one of the member states, there shouldn't be duplication. Instead, let us encourage cross-border collaboration in advancing further these solutions which have got they have got multiple functions. And I think if we map out and get an inventory of what we have within the East African region, then it should be possible to put priorities on what digital technologies, on what digital solutions would need investment in terms of putting more resources and then get them to the end users. So my humble request, if members would agree, we add a mapping component. Thank you.
Thank you, Honorable. We have added it. I would like also to get concurrence from other honorable members in this session. Antoine, you have your hands raised. Please give your submission.
Thank you very much. Mine will go also in the same vein, what this Honorable Kipanula has just discussed. There is strong involvement of the private sector and startup community that is needed as well. And this goes in line with resolution number 2 and resolution number 7 as well, is to see how we bring other innovators, not letting only government institutions or similar to drive this kind of initiatives, but co-creating digital solution. Incubating means also bringing startup and looking at young innovator as well, so that we can capitalize on already existing technologies, what has been successful, and not reinventing the wheel when we already have a solution within our region. Thank you.
Thank you, Antoine. Point is taken that we need to involve the private sector in startup innovations for e-health and telemedicine innovations. We have captured that and we shall incorporate it in the final resolutions. Honorable members, let me take this opportunity to thank you for your submissions. With these revisions in the list of the resolutions, would like to ask adoption of this resolution before we close our ministerial session. Would like to have a proposal and then somebody also who can second the adoption of this resolution. I thank you.
I propose we adopt the resolutions.
Honorable Chipanura proposes. Anybody who can second the resolution, to the adoption of these resolutions?
I second adoption of resolutions, but with a minor request that for cross-border systems, like those registering medical products, we put in place a mechanism to share information. Let's say if a drug is recalled on an East African community, that information be shared across the portals so that that drug is not imported in country and all that. Thank you very much.
Thank you, Edith. That is part of the, will be part of the East African Regional Digital Health Agenda Framework. It will be catered in the EAC regional framework to make sure that the cross-border system mechanisms give the rights of sharing data and also keeping this data safe in the database. We have Mr. Iromo.
Thank you. So we are saying that the STECO has done a very good work in the preparation of the regional health telemedicine workshop, virtual exhibition, and ministerial conference, and Tanzania appreciates the continued support given by the member state by the STECO. The current meeting is taking place when at a time when sustained public health measures are still required in the response to COVID-19 pandemic. We continue to recognize the vast extent of the tragedy that COVID-19 pandemic continues to have on the social, economic, and the health of millions of people around the world. Tanzania government, through its policies, has been in front line embracing the use of information communication technology, ICT infrastructure at various levels in the health sector. As a country, we recognize the importance of prioritize equitable access to quality health services through e-health and telemedicine, especially to citizens in the very remote areas. Tanzania developed and implemented the e-health strategy 2013-2018, which was also reflected in our health sector strategic plan 4. And currently, we are implementing digital health strategy 2019-2024, which aims to improve health for everyone, everywhere, by accelerating the development and the adoption of appropriate, accessible, affordable, scalable, and sustainable person-centric digital health solutions to prevent, detect, and respond to epidemics. We hope STECO, through different partners, will continue to give financial support to its member states. And we understand that in investing in healthcare workers by building capacity, we also facilitate them to have continuous medical education. We are positive that this conference will make fruitful deliberation on these issues for the benefit of all East Africans. Thank you very much.
Thank you, Honorable PS, for the opening remarks and also for your initiative to join this ministerial session as we are coming to the end of the session. And we also, after that, we shall send them to you for endorsement, for signing them, because they have to go to the Sector Council of Education, Science and Technology and Innovation, and also Sector Council for Health, Council of Ministers at the EAC level governance structures for approval. So with these resolutions, we shall be able to look at the trend of implementation and also evaluate ourselves in the next suggested upcoming E-Health conference, which will be 2023 in October in Nairobi. And we shall also present how far we have implemented these resolutions and also come up with more resolutions in case there are more to be implemented. Ladies and gentlemen, honorable members, I take this opportunity to thank you for taking time off your duty, busy schedules to attend this important conference, which has come actually on our advantage of using technology solutions to improve health care delivery, and which benefits the citizens of EAC. With this dialogue, we hope to achieve a lot and to learn from each other, as we have discussed national initiatives of health, digital health in the partner states. I would also like to encourage partner states to learn from each other and also share experiences with other partner states, so that the digital health initiative developed into a program can be able to be implemented in the partner states and benefit the citizen at the community level. With this, I thank you all. and wish you a good evening, and looking forward to 2023 for the 4th E-Health and Telemedicine Conference. I thank you all and have a nice evening.